Hi, I'm Garvin. Welcome to another telehealth video series. In this video, I will give a brief overview of what you need to know about infertility. In particular, I'll cover what is infertility, how do you treat it, and how you can live with infertility. So we start with what it is. If getting pregnant has been a challenge for you and your partner, you're not alone. Upwards of 15% of couples are infertile. Infertility is defined as not being able to get pregnant despite having frequent unprotected sex for at least a year. If that definition of infertility applies to you and your partner, there's a chance that something treatable may be interfering with your efforts to have a child. Fortunately, there are many safe and effective therapies for overcoming infertility. These treatments significantly improve your chances of becoming pregnant. Most couples achieve pregnancy within the first 6 months of trying. Overall, after 12 months of unprotected intercourse, approximately 85% of couples will become pregnant. Over the next 36 months, about 50% of the remaining couples will go on to conceive spontaneously. The main sign of infertility is the inability for a couple to have a child. In some cases, an infertile woman may have abnormal menstrual periods. An infertile man may have some signs of hormonal problems, such as changes in hair growth or sexual function. In general, don't be too concerned about infertility unless you and your partner have been trying regularly to conceive for at least 1 year. Talk with your doctor earlier. However, if you plan to conceive and you're a woman older than 30 or haven't menstruated in 6 months, you're a woman who has a history of irregular or painful menstrual cycles, pelvic pain, endometriosis, pelvic inflammatory disease, or repeated miscarriages. Or you're a man with a low sperm count or a history of testicular, prostate, or sexual problems. The human reproductive process is complex. To become pregnant, the intricate processes of ovulation and fertilization need to work just right. Each month, the pituitary gland in a woman's brain sends a signal to her ovaries to prepare an egg for ovulation. The pituitary hormones, follicle-stimulating hormone and luteinizing hormone, stimulates the ovaries to release an egg. This is called ovulation. It is during this time that a woman is fertile, usually about day 14 of a 28-day menstrual cycle. The egg travels through the fallopian tube and can be fertilized within about 24 hours after its release. Conception is more likely to occur when intercourse takes place 1 to 2 days prior to ovulation. For pregnancy to occur, a sperm must unite with the egg in the fallopian tube during this time. So sperm are capable of fertilizing the egg for up to 72 hours and must be present in the fallopian tube at the same time as the egg for conception to occur. If fertilized, the egg moves into the uterus where it attaches to the uterine lining and begins a 9-month process of growth. So for some couples attempting pregnancy, something goes wrong in this complex process, resulting in infertility. The cause or causes of infertility can involve one or both partners. In about 20% of cases, infertility is due to a cause involving only the male partner. In about 30 to 40% of the cases, infertility is due to causes involving both the male and female. And in the remaining 40 to 50% of cases, the infertility is due entirely to cause involving the female. So next is, how do you treat infertility? Treatment of infertility depends on the cause, how long you've been infertile, the age of your partner, and many personal preferences. Some causes of infertility can't be corrected. However, a woman can still become pregnant with assistive reproductive technology or other procedures to restore fertility. So treatment for couples. These approaches can involve steps related to the male and to the female, or both. Increased frequency of intercourse. Having intercourse 2 to 3 times a week may improve fertility. However, too frequent ejaculation can lessen sperm quality. Sperm survive in the female reproductive tract for 72 hours, and an egg can be fertilized for up to 24 hours after ovulation. Treatment for men. Approaches that involve the male include treatments for general sexual problems. Addressing impotence or premature ejaculation can improve fertility. Treatment for these problems often is with medication or behavioural approaches. And lack of sperm. If a lack of sperm is suspected as the cause of a man's infertility, surgery or hormones to correct the problem or use an assisted reproductive technology is sometimes possible. And treatment for women. Fertility drugs are the main treatment for women who are infertile due to ovulation disorders. These medications regulate or induce ovulation. In general, they work like natural hormones, such as follicle stimulating hormone and luteinizing hormone, to trigger ovulation. And finally, how do you live with it? Coping with infertility can be difficult. It's an issue of the unknown. You can't predict how long it will last or what the outcomes will be. Infertility isn't necessarily solved with hard work. The emotional burden on a couple is considerable, and plans for coping can help. So planning for emotional turmoil. So you set limits, decide in advance how many and what kind of procedures are emotionally and financially acceptable for you and your partner, and attempt to determine a final limit. Consider other options, determine alternatives, so adoption, donor sperm or egg, surrogacy, or even having no children as early as possible in the fertility process. This may reduce anxiety during treatments and feelings of hopelessness if conception doesn't occur. Talk about your feelings, so locate support groups or counselling services for help before and after treatment to help endure the process and ease the grief should treatment fail. And finally, there are numerous products available at Lynch's Pharmacy in Douglas and Cork to assist you in managing infertility more effectively on a day-to-day basis. To start with, we have numerous products to get you started on an exercise program, such as exercise balls, floor mats, weights, and various other items to get you up and running on a program that we create together and is tailored specifically to you. We also have various supplements and products which you can purchase from us without a prescription, such as CoQ10, zinc, vitamin E, folic acid, vitamin C, and psyllium husk and fish oils. We also stock light boxes to promote relaxation, blood pressure monitors, blood sugar monitors, and body fat monitors. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together, we create a cohesive management plan which enables you to take a more active role in managing infertility with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.